Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today, Morgan Hare and Dr. Rod Rohrich discuss the AiRS Foundation, an organization dedicated to educating breast cancer survivors about restorative breast surgeries and the options that many may not know about.
Hi, this is Rod Rohrich and Morgan Hare, and we're back on MD Source. And today we're talking about a topic that's actually very near and dear to our hearts. And it's something that's very human. It's about giving back. You know, life is all about giving back, and yet so few people do. We are so fortunate to live in a wonderful place like the USA. And of course, we've all worked hard to do and be successful in our lives, but it's truly, you give more, you get more back by giving back. And that's why Morgan and Hare and I and Genty did something I think that's very worthwhile several years ago. And that's forming a nonprofit called the Alliance for Reconstructive Surgery, called AiRS. And I'm going to have Morgan, who so elegantly talks about her passion for this, tell us all about why we did it and what we're doing and why it's so important. Morgan?
So our lives have always had some ups and downs, but through it all, we know that we're blessed and we wanted to give back. So Janet and I wrote to Dr. Rohrich and said, we wanted to give a voice to something that didn't have a voice. And what was that? There's so many people talking about such a variety of subjects where people know about it, but what's something no one knows about? And he wrote back to me and said that up to 70% of women who have mastectomies don't know about their reconstruction rights, options, and or they don't have the funds to pay for it. At first, we were sort of surprised at that because, fortunately for us, everyone we know has good insurance. So their medical bills, their reconstruction gets paid for. But when we started to really dig into it, we realized there was a large group of underserved women who didn't have a voice. They had nowhere to turn to. No one told them when they were having their mastectomy or a lumpectomy what their choices were. So that's why we started the Alliance in Reconstructive Surgery. It was our way to give back and give a voice to a cause affecting women who are not as fortunate as we are. It was really important to us. So while the treatment of breast cancer has progressed, 1/3 of all breast cancer patients will inevitably have a mastectomy. In addition, more women are being diagnosed with the BRCA gene mutation and will opt for a risk-reducing mastectomy.
Morgan, tell us about what's BRCA. Tell the listener what BRCA is and why that's so important. I mean, it's obviously a group of women that's really, I think, has been neglected.
Well, it has been neglected because it really wasn't until sometime in the 80s when Dr. King started doing all this research to try and figure out, was there a gene that was causing cancer in women, breast cancer? And through all of her studies, she really sort of collected data from thousands of women to look at their health risks, what they were dealing with, and their genetics to really come up with, was there a gene that they could identify that was causing breast cancer, not only in women, but in men as well. Mm-hmm. I think what's unknown is even though the gene is passed down through women, it can be passed down through men. And for men, the gene doesn't necessarily always mean that they'll get breast cancer, but could really be related to other kinds of cancers for them, which is really important. And at first, it was super expensive to get tested for this, but not so much anymore.
And I think that's, this group of women is just a segment of the people that we reach out to help, because there are so many women that, as Morgan mentioned, up to 70%, they don't have the access to the information, they're not given the options or the ability to have an option or even talk about breast reconstruction. And I know that sounds unfathomable in this country today, but it's true. Even though we have 2 federal laws that either state that you have to talk about the options for breast reconstruction and that it's mandated that you get coverage. Well, that sounds great, but in reality, that's a very thin-veiled law that actually a lot of insurance companies get around. And that's where AiRS picks up, because we're the safety net. We're the ones, as Morgan will tell you, and later on in other podcasts, we're going to have some of our patients on who tell it better than we do, because we're the safety net that helps to support, helps to advocate, and actually helps to physically help through our volunteers get these women to the right doctors, the right facilities, to get best care, and we fund and support it. So Morgan, give us some examples of that.
So restorative breast surgery is really an integral part of physical and emotional healing for many breast cancer survivors in order for them to feel whole again and restore their self-esteem. It's really why, for some women, reconstructive surgery is really important. For other women, going flat is just fine. They've adopted to that. Some of them will tattoo their chests and do a variety of other things. But for women who want reconstructive surgery, they should be able to have it. So there are other organizations that are really dedicated to education, funding research, finding a cure. But there really wasn't a national organization dedicated to educating women about their reconstructive options and sort of help pay for it if they couldn't afford to do it. So if one goes to our website and fills out an application, we look at those applications on a daily basis, and we assign an advocate to each person, each woman who contacts us. And part of the reason for our advocacy program is a lot of these women have no support system.
Right, and also our advocates are phenomenal. Most have had breast cancer, so they had not only walked the walk, they talk the talk because they've been there. So they go with these patients, they go to the appointments, go to these heart-wrenching consults, and actually help them, give them the right answers to these hard questions. And I think they're phenomenal. And the incredible thing, right, Morgan, is the need is unbelievable. We're trying to, kind of keep our finger in the dike, but it is unbelievable the number of patients that need us.
Right. I take every first call that comes in, and every story is heartbreaking in a way and reminds me again when I hang up is how blessed I am. Recently, I had a 23-year-old who had breast cancer, and her surgeon was happy to take her Medicaid. But the two reconstructive surgeons that he worked with would not take her Medicaid. You can imagine how devastated a 23-year-old is not to have someone who wants to do her reconstruction. Luckily, one of the other doctors in the town where she will donate his services. And we got him and his office involved, and they got expanders, they got implants, and we got her on the list, and he really did her surgery pro bono.
Right.
And that's why our advocacy group is so great, is because once they're assigned to a woman in need, they'll work with them to talk to their doctors and make sure that they're really the right doctor to be doing what they're doing. Can we get them to somebody who's one of the doctors who works with us who will do their surgeries pro bono? This is all really important, and they're there for them. The advocates are there for them the moment they call them till beyond their reconstructive surgery. They're their
Right.
go-to person to talk to.
Right, and as Morgan mentioned, so many people say, oh, I have Medicare or I have Medicaid. The problem is there are so few doctors that take Medicaid in this country because of the fact that Medicaid often doesn't even come close to coming close to paying the expenses for the physician and even their overhead. So the plea comes from us, and sometimes I'm calling them, we're calling and asking them, and when we do, most physicians actually respond positively. And sometimes it takes months to get it done after they've had their mastectomy. So we persevere, and that's where our advocate group has been phenomenal. Wouldn't you say, Morgan?
Absolutely. And Tamra, who runs our advocacy group, she is a breast cancer survivor, and her heart is so big of what she does to ensure that every patient gets what they need, gets them to a great doctor, helps reduce the cost of the surgery.
We're gonna have Tamara and actually one or two of our patients on in the
Right.
future to really exemplify why this is such an incredible need and why we're glad to be part of it.
Life throws you curves, and the worst curve is all of a sudden to hear you have breast cancer for a woman. We live in a breast society, and unfortunately, for a lot of women, when they hear this, it's devastating news, the fact that they're going to lose their breasts. And what does that mean to their relationship? How does it affect their marriage? How does it affect their friendships? We had one woman who had the BRCA gene, and she knew she had a 90% chance of getting breast cancer, and her family and friends questioned her about even having a prophylactic mastectomy. And she said, I have 3 little kids, and I want to make sure I live long enough to see them grow up and get married and have children of their own. So sometimes it's about listening to somebody and giving them the encouragement they need when everyone else around them is saying, well, you have a 10% chance of not getting breast cancer. Well, if that was me, what would I do? And I'd certainly think about that long and hard, but I'd probably really go ahead and have a prophylactic mastectomy.
Right.
It's considered a woman in her 20s who finds out she has the gene and is not married. How does she deal with that when she meets somebody? I mean, these are all issues that come up for people when they have the gene, when they get breast cancer. What is somebody else going to think? What happens when I go to the beach? What do I look like when I wear a bathing suit?
Yeah,
It's
and
all issues.
Right, and 1 in 8 American women get breast cancer. So this is not a minor or small deal. This is huge. No. Thousands and thousands of women have breast cancer, and they all should have the opportunity to have or to be educated about the options for reconstruction. And I think that should be their choice. And what AiRS is doing is giving women their choice, because we're advocating, we're educating, and we're also providing support so they can do so and get best care.
Right.
And that's why it goes hand in hand with what we do in MD Source, because we're giving you best information, best healthcare information, so that you can be a better informed you.
So if you need help paying for your reconstructive surgery, you can go to our website, AiRS, AiRSfoundation.org. Find the application. It's there. Fill it out and send it to us. Or you can call the 800 number listed there. That's fine. You can find us on Facebook, Twitter, and Instagram. So follow us as we provide great information, stories about women who have been through this, and also the latest on issues relating to breast cancer therapy and a host of other subjects.
Okay. So, Morgan, I want to thank you and Janet for really thinking up this idea to give back. It means a lot to all of us, means a lot to me, and really it's part of what we do as human beings. So I salute you.
Well, I salute you too, because if it wasn't for you, we wouldn't have known this was an issue. So, we work hand in hand as partners to really bring the best information and care to people, because that's what everybody wants now.
So, Morgan, what if somebody wants to donate? I mean, tell us about the event that's happening in New York. So, we obviously need your help to do more. We are just scratching the surface here. So tell us what somebody wants to donate.
So if somebody wants to donate, they can go to our website, and there's a donate page, and you can make a donation. And every donation counts, whether it's $1 donation or $1,000 donation, because for some women, and maybe they just want nipple tattooing, but they can't even afford that, and they can't meet their copay. Their copay could be $5,000, but their nipple tattooing can be $600. And we have some tattoo artists who help us and do the tattooing for free, but it doesn't mean that we don't need money to help cover the cost of tattooing, surgical care, implants, and a variety of other needs that people have when they're going through this. So donations are really important to help us. And in October, there's BRA Day, which is Breast Reconstruction Awareness. And we're partnering with an organization called Breasties, which was started by a young woman in her 20s who had the BRCA gene and had a prophylactic double mastectomy. So we're partnering with her in BRA Day in New York to create an event where we bring in a number of women who have had breast cancer, the gene, and we're treating them to manicures and massages and some education about how we might help them. We have an event here also in the month with the Breast Cancer Center
In Dallas.
To really get the word out, because this is the breast center, helps a lot of underserved women, and they also need to know about reconstructive surgery. Just because they're underserved and don't have insurance and they come to Parkland doesn't mean that they don't want reconstructive surgery, and they should know about it. So we'll have, as we grow, a variety of different events in different parts of the country to really let people know this is what we're doing. We just had a wonderful article in Sway that talks about what we do and how we've helped people. And we continue to get great coverage to let people know we're here. So if you know someone in need, please have them contact us, and we're here to help.
Well, thanks again, Morgan. It's great. We're giving back, giving so that others can get best care. Till next time, this is Rohrich and Morgan Hare from MD Source.
For more information on the AiRS Foundation, visit airsfoundation.org. That's AiRS Foundation.org. From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.